In this video, we are going to be looking at the etiology, risk factors, and types of peptic ulcer. Hi, I'm Sharon. I'm working as an associate professor at M College of Nursing. The following are the objectives that we'll be addressing in this video. A peptic ulcer is an excavation, that is, a hollowed out area that forms in the mucosal wall of the stomach in the pylorus, which is an opening between the stomach and the duodenum. It can also occur in the duodenum or in the esophagus. It is frequently referred to as gastric, duodenal, or esophageal ulcer, depending upon its location, or broadly termed as peptic ulcer disease, that is PUD. It is the erosion of a circumscribed area of mucous membrane, and the erosion may extend as deep as the muscle layers or through the muscle even into the peritoneum. More likely to be in the duodenum than in the stomach. As a rule, they usually occur alone, but they may also occur in multiples. Chronic gastric ulcers tend to occur in the lesser curvature of the stomach near the pylorus. These pictures show how a peptic ulcer will look via an endoscope. Let's look at the etiology and risk factors of PUD. It is found in greatest frequency in people between the ages of 40 and 60 years. It is relatively uncommon in women of childbearing age, but also observed in children and infants. After menopause, the incidence in women is almost equal to men. It results from infection with the gram-negative bacteria, that is, H. pylori or Helicobacter pylori. It develops more commonly in people who are tense, but the contributing factors are uncertain. Excessive secretion of hydrochloric acid in the stomach leads to formation of gastric ulcers, and stress may also be associated with its increased secretion. It is also found that ingestion of milk and caffeinated beverages, smoking, and alcohol also may increase hydrochloric acid secretion. In continuation, familial tendency is a significant predisposing factor. There is a genetic link that blood type O are more susceptible to PUD, and there is an association between duodenal ulcers and COPD or CKD. Other predisposing factors include chronic use of NSAIDs, alcohol ingestion, and excessive smoking. PUDs can also be caused by excessive amounts of the hormone gastrin, which is produced by tumors. Now, let's look at the differences between gastric and duodenal ulcer. We will look at each of the features. With regard to age, gastric ulcer is more common between the age groups of 50 to 60 years, whereas duodenal ulcer between the age group of 20 to 50. Male-female ratio almost equal in gastric ulcer, whereas 2:1 in duodenal ulcer. Pain felt over the umbilicus and left to midline in gastric ulcer, and felt above the umbilicus and right to the midline in duodenal ulcer. Radiation of pain in gastric ulcers, no radiation, whereas in duodenal ulcers, it may radiate to the back. The nature of pain in both cases are periodical. With regard to weight loss, it is present due to reduced intake in gastric ulcer, whereas in duodenal ulcer, no weight loss as patient feels better with eating and hence goes on eating. In continuation to the differences, with regard to hemorrhages, hematemesis may be present, that is blood and vomiting, in gastric ulcer, whereas in duodenal ulcer, black or bloody stools, that is melena, may be present. With regard to gastric symptoms, there can be a sensation of feeling of fullness, indigestion, heartburn, gas trouble, or belching. Whereas in duodenal ulcer, bloated feeling can be there because of the intestinal gas that is accumulated. Malignancy, chances are common in gastric ulcer, whereas it is rare in duodenal ulcer. With regard to aggravating factors, in gastric ulcer, it occurs immediately after food, whereas duodenal ulcer, it is 1 to 2 hours after food when the stomach gets empty, or in the middle of the night, or when the patient is sleeping. With regard to ameliorating factors or alleviating factors, for gastric ulcer, vomiting or alkali foods, and duodenal ulcer, after taking the food, the symptoms will be lesser. Zollinger-Ellison syndrome, or ZES, is suspected when there are several peptic ulcers or an ulcer that is resistant to standard medical therapy. The findings are that there is hypersecretion of gastric juice, duodenal ulcers, and gastrinomas, that is, islet cell tumors in the pancreas. 90% of these tumors are found in the gastric triangle, which encompasses the cystic and the common bile ducts, the second and third portion of the duodenum, and the neck and the body of pancreas. We also see that approximately 1/3 of the gastrinomas are malignant. Patient will also have diarrhea and steatorrhea, and it can coexist with parathyroid adenomas or hyperplasia. Thereby, there will be exhibition of signs of hypercalcemia. Most common complaint in CES will be epigastric pain. And we should also understand that H. pylori is not a risk factor for CES. Stress ulcer. Acute mucosal ulceration of the duodenal or gastric area that occurs after physiologically stressful events such as burn, shock, severe sepsis, and multiple organ traumas. This is common in ventilator-dependent patients after trauma or surgery. Fiber optic endoscopy within 24 hours after injury reveals shallow erosions of the stomach wall. By 72 hours, one can see multiple gastric erosions. As the stressful condition continues, the ulcers spread. But when the patient recovers, the lesions are reversed. This pattern is typical of stress ulceration. Stress ulcers usually is preceded by shock. What happens here is there is decreased gastric mucosal blood flow, and there is reflux of duodenal contents into the stomach, and large quantities of pepsin are released. Thereby, the combination of ischemia, acid, and pepsin creates an ideal climate for ulceration. Next, we're going to be looking at Cushing's and Curling's ulcer. Cushing's ulcer is common in patients with trauma to the brain, occurs in the esophagus, stomach, or duodenum, and are usually deeper and more penetrating than stress ulcers. When it comes to Curling's ulcer, this is frequently observed about 7 to 2 hours after extensive burns and involves the antrum of the stomach or the duodenum. The following are the references. Thank you for your patient listening.